I'm so pleased to welcome back to Kidney Plugged In somebody that many of your viewers are going to be familiar with when you see her. She's a kidney transplant recipient. I think 22 years ago she got her kidney transplant and really has been a Kidney Foundation volunteer extraordinaire, being involved in so many campaigns. And today she's on the show to talk about a new initiative in the Okanagan area that she is organizing and coordinating. I'm so pleased to be welcoming back to Kidney Plugged In, Annick. Hi, Annick.
Thanks for having me, Barb. I'm so happy to be here. Talking about the Warm the Soul campaign is something that really means a lot to me. It reminds me of before I had my kidney transplant, my feet were always cold, and I remember a friend gave me a big, thick pair of warm socks for Christmas. And I literally remember that to the day because I wore those socks out till they had holes in them. It made a big difference in my life.
So I'm taking the name Warm the Soul. There's a little play on words there for this campaign.
It's a bit of a pun, right? We're trying to reach the kidney patients, the dialysis patients, specifically that are going in center, in hospital, warming their soul, but also warming the soles of their feet.
That's terrific. And it's actually so apropos for February, right? It's the month of warming hearts, Valentine's.
It's good timing. It's cold out. Everybody's got cold feet.
So you were saying, actually, this idea came up because of what you personally experienced yourself.
That's right. So I have had my kidney transplant for 22 years. And I remember pre-transplant, I had a very best friend and he surprised me with big, thick socks for Christmas. And I was surprised. I guess it's something that you really get used to having after a while. I probably mentioned it. Oh, my feet are like icicles. I've got ice cubes in my feet. Whatever the case was, and he thought to get me big, thick, warm socks because I was confused at first. And I said, why would you get me these giant socks? And he said, your feet are always cold. And I said, you're right, my feet are always cold. And so another volunteer in the South Okanagan, Teresa Atkinson, and Vivian Short, they've both participated in giving out the socks with me over the past few years. I started it in 2018, and Teresa and I used to deliver mandarin oranges and candy canes once a week for the month of December to all of our dialysis patients. And so I thought, I love this idea, but they're peeling the candy cane, they're putting it in their mouth, they know it's from Kidney Foundation, but long term, how can we get them to remember who they got it from? How can we get them something that's going to last longer than that 2-minute mandarin orange? And I work at at a sports store, and I get a great discount off of retail pricing. And I saw these socks, and I thought, I sell a ton of these because a lot of people have cold feet. And I thought, how can I make it affordable? Made a proposal to the Kidney Foundation and said, can I buy socks for every patient rather than candy canes and mandarin oranges? And so that was approved, and that's where it started. I thought, warm the soul, but not only that, warm your feet, warm the soles of your feet.
Just hearing about this, it really is a genuinely thoughtful initiative. It really is a great example in a way of paying it forward, right? This happened to you all
Yes.
years ago.
I experienced it myself. That being said, I saw kidney patients after the fact because we went into the hospital and hand-delivered them and said, I want these people to realize that I'm not only a volunteer, but I'm also a patient. Like, look, okay, I've never done dialysis myself, but I have been sick. I was just about to go on dialysis when I got my transplant. In fact, they wanted to do a session of dialysis, but being young, naive, uninformed, uneducated, I really didn't know how critical it was. I really didn't know how sick I was. This is a long time ago, and the machines are very intimidating. You have to sit there and kind of almost not move very much, because on one arm you have the dialysis going on, and on the other arm you've got your blood pressure cuff to make sure that you're not going to be sick in some way, and you're hooked up to the machine. You can't get up and walk around whenever you want. So it's a hissing machine. It's intimidating, especially when you're not familiar with it.
Annick, I know, knowing you, you're from the Okanagan area, Penticton, I think, right?
Right.
Tell us about where this initiative is taking place. Where are you going to be delivering?
So for the past few years, we've been delivering to Penticton Regional Hospital. And this year I thought, we're really missing a lot of patients, especially in the Okanagan, because that's where I am. And I thought, can we expand our project? And so when I made a proposal this year, it wasn't just 40 some odd socks. I suddenly need over 200 pairs of socks. But that just goes to show you how many kidney patients are out there, most of them waiting for a kidney transplant. So that being said, it's eye-opening. 10% of the population has kidney disease. So don't be surprised when I give you those numbers just for our little area. And there's a lot of people who are doing dialysis from home, so it's not even counting them. So we've expanded our project this year to include Penticton. We're also going to Kelowna Regional Hospital, and we're going to Vernon, and there's also a dialysis center in Rutland, and so everybody's going to be getting socks. And one thing that I was made aware of that I'm not diabetic, I've not lost a limb. Of course, it didn't occur to me before. People who are getting socks who are amputees are not going to get use out of our socks. So we have this year started including toques into our program. And so we made sure that we get the nurses in advance to go around and see, would you prefer a pair of socks or would you like a toque?
What a great initiative, Annick, and I love the addition of the toques this year. You kind of got kidney patients covered from head to toe.